Hello my wellbeing buddies, it's me Steve and welcome to this course. You're going to be learning about emergency first aid for mental health. My name's Steve Davis and I'm a registered mental health nurse. So the aim of this course really is to give you an overview of how to manage somebody in crisis. And we want you by the end of this course to feel confident and have the skills necessary. Make sure you've got a pen and bit of paper ready because as any good learner you should be ready to make some notes, and especially if you want to take the endpoint exam to get your certificate. So let's just start off with what mental health first aid is. Now on the screen you can see we've got an acronym called ELGI. Now this is from Mental Health England. This isn't my acronym. I have borrowed this for all intents and purposes for this session. And it is a powerful tool because if you forget everything else that I show you today, you will hopefully, if you follow this, you'll understand support strategies. So let's get into this. The aim of the session here is to provide and maintain assistance to support somebody. So we've just in that ELGI piece. So it's about managing that crisis and that emergency. We're going to promote recovery and reduce the impact of mental health. So we're not going to try and trigger anything. We don't want to open anything up. We want to keep it nice and contained and keep people safe. I want you to be able to identify some signs and symptoms of common mental health problems. And therefore, if you know some of those signs and symptoms, no different to normal first aid, you'll know what you're dealing with. I want you to be able to help individuals to access that appropriate professional support. So you've just seen that from ELGI. So you need to know those refer pathways. What is it you're going to give somebody? Because that little piece of nugget that you give them is going to be the difference of a good day or a bad day or a good outcome or a good outcome, sorry, or a bad outcome. I want you to be an ambassador. So listen to that. I want you to be an ambassador to reduce stigma and discrimination, because ultimately unhelpful language just stops people from talking. If people feel judged, if people feel that you're going to talk about them or there's this level of stigma, they're not going to open up. And that puts more people at risk and that increases our risk of suicide or self-harm. You're going to enhance your knowledge and skills. And again, hopefully from this training, you can go back to your organisations and feel a bit more confident to maybe be a mental health ambassador or a mental health champion. Say, look, I haven't got all the answers, but I've got some of them. If you need to come and talk to me, come and talk to me. And then finally, I want you to promote a positive mental health well-being approach. And again, having those resources to meet individual needs. And we'll show you where all of those resources are. So I think you'll agree, quite an ambitious amount of learning to be done. So overall, what is the aim of the emergency mental health first aider? Well, quite simply, no different to normal first aid, you are there to promote early interventions in a timely support, hopefully reducing the experience of the mental health, so stopping it from raising up and getting much worse. And I want you to reduce the negative impact on that mental health problem for the individual and equally for the family and people around them, because it can be incredibly distressing watching somebody experience a crisis situation. So how are we going to do that? What are we going to learn? Well, here you can see I've broken this down into 10 modules or units. The first one really is to understand the role of the mental health first aider. It's got to be right. What are my roles, responsibilities? What does this mental health nurse Steve want me to do? Then we're going to talk about effective communication, because for us in mental health, words are our first aid kit. If we get it right, we can promote healing. If we can get it wrong, we promote trauma. So we want to make sure that the language we use is absolutely right. Then we're going to move into some of the top mental health crisis problems. So here you can see we've got some suicidal behaviour and ideation. So ideation just means thinking. We're going to look at panic attacks and anxiety, some psychosis. We're going to look at severe anxiety with depression there. Unit 7, we're going to look at substance misuse. Unit 8, we're going to look at abusive and violent behaviour. Number 9, we're going to be looking at stress. And number 10, self-injury and harm. And I have put on number 11, which is CAMS, Children and Adolescents Mental Health. So let's just dig a little bit deeper into this and by what we mean by some of these terms. So suicidal behaviour and ideation, this includes talking about suicide, threatening to harm oneself, or engaging in behaviours that could result in self-harm or suicide. So they don't have to be the act of it, it's just the threat to do it. Because ultimately we have to say, is a threat to harm oneself, to kill oneself, a normal response? And the answer is probably not, meaning that they're in emotional distress and their emotional regulation is slightly off key, and we'll talk about that when we get to that module. We're going to look at panic attacks, and this is the sudden or intense episode of anxiety, which includes those symptoms of rapid heartbeat, shortness of breath, sweating and trembling. And I think we all know what panic attacks are and what anxiety there is. We're going to look at psychosis. So this means normally hallucinations, maybe hearing things, seeing things, and delusions, so strong beliefs around things. We're going to look at the depression, so this includes those intense feelings of sadness and that worry around daily functioning. We're going to address some substance abuse, so looking at drugs and alcohol, what causes them and how we can manage that. We'll look at aggressive and violent behaviour. This is typically physically or verbal, and we can look at what triggers that and how we can support somebody who is being aggressive or violent. We're going to move into acute stress reduction, so they're dealing with panic, confusion, dissociation and any kind of traumatic events, and looking at systems to manage those, and then looking at that self-harm or self-injury, and that refers to the intentional cause or deliberate harm to one's body, so that can include cutting, burning, scratching, hair pulling, amongst other things there. So you can see here, it is important to note that mental health emergencies can vary widely. Symptoms may change, distress levels, so we call it a continuum from little to quite impactful. And everyone experiences it based on different triggers. So And that might be age, it might be sex, it might be previous mental health history, it might be physical mental health, it might be medication. So there's lots of different things there. What is important is for you to think about your ELGI, going back to that very first slide that I showed you, and knowing your points of referral. So just maintaining a very calm and presence around somebody, feeling grounded enough to support them into maybe some therapeutic interventions whilst you're getting that emergency support. So let's start off with Unit 1 then. What is the role of a mental health first aider? Well, if we took out the word mental health and I said to you, what is the role of a first aider? For those that have done this course before, you're now shouting at me. Stop a situation becoming worse. So let's look at preserve life. So if we're looking at the functions of preserving life, this is an emergency situation where the priority of the first aider in mental health is to preserve life. So this may mean you take immediate action to prevent the risk of self-harm or suicide, and that could be removing items, calling the emergency services, or alternatively, you may have to apply your physical first aid skills here. So at this point, you may have to go straight into basic life support. Do you need to check for danger? Response, hello, can you hear me? Can you open your eyes? Airways, head back, open the mouth. Look, listen and feel for breathing for 10 seconds. Watch that rise and fall on the chest. And if there is no rise and fall, you're probably going to go straight into your 30 chest compressions whilst calling for an AED machine or alternative help. It may be the fact that you're dealing with somebody who has self-injured. So again, going back to our first aid principles, we're going to elevate the injured part above the heart so it slows the bleed down, and we're going to do red. So we're going to rest, elevate and direct pressure. So we just need to go back to our basic first aid principles to preserve life. We're then going to provide reassurance. So once we're safe and we're ready to move on, we're going to look at the role here to reassure and support that person who is experiencing the mental health crisis. And this is going to involve listening to them, offering those words of encouragement and support, normalising what's going on, making them feel being non-judgmental, and making them feel that they're being heard, probably for the first time. So just do that active listening, and we'll talk about that in a minute. And equally, we're helping the person to feel safe and calm. And all the time somebody feels safe and calm, you are preserving their life. Ultimately, we don't want the situation to get worse. So the third role here is to prevent the situation from worsening. So this involves identifying those triggers and those stressors and maybe taking them away and reducing them. So it may be the fact that somebody's watched something on their phone and the phone's still playing. It may be that somebody's watching. Whatever it is, we're going to try and look at those triggers, reduce them, move them out of the way to ensure we stop the situation from being worse. And ultimately, you're not going in playing therapists here. We don't want you to ask them about trauma and opening things up, making things much, much worse for them. We just want you to be this listening ear, offering that reassurance and keeping things nice and calm. And then finally here, we want you to promote recovery. So to promote recovery then with the ongoing mental health piece, That involves seeking that additional support, advice and guidance, and making sure you've got that professional handover going in, and those coping strategies and those self-care techniques. And again, in the online lesson, or if you go to my YouTube channel, The Mental Health Nurse, you will see many coping strategies and many self-care techniques, and they are all worth watching. And that could be things such as visualization, positive self-talking, grounding skills, meditation, providing a safe space, whatever it is, they're all there for you to use. So let's look at Unit 2, effective communication. Now, I think it was Egan who came up with SOLAR. If I'm staying corrected, pop it in the comments below, but I think it was Egan who created SOLAR. And it's an acronym for really good communication techniques. And what SOLAR does is it provides a safe, therapeutic environment for you to talk to somebody and open up about the way that they feel. And by providing this safe, therapeutic environment, you are more likely to get a better all the time. So it doesn't just end there, because effective communication has a two-way process, and this is Shannon and Weaver, for those that like a bit of theory. Shannon and Weaver have this theory that we have the sender and the receiver. The sender is, I'm going to tell you something. The receiver is the one listening. And what our job is to make sure that as I am talking and communicating, it is clear and that the receiver has understood what I'm saying. But equally vice versa, if you are the receiver, make sure that what you are receiving, you are clear. Make sure there's no ambiguity, especially around suicide. And I'll give you some ambiguity here. So, for example, um, are you feeling suicidal? Well, yes, I'm feeling suicidal. Do you have any plans? Yeah, I have some plans. So ultimately, what we've not asked is, are you planning to kill yourself? Yes or no? Very clear. Yes, I'm planning to kill myself. Okay. Can I ask, what are your plans? Great. Now we've got that information. So as a receiver, I'm not wondering if it's going to happen. I know it's going to happen because you've told me, and you've told me your method. And it is a difficult thing to do. But just talk to somebody about this. Get that awkward conversation out the way. Once you've had it a couple of times with people, it does come a bit more naturally. But what we don't want is to be left with anything in people's minds where they've not communicated clearly. So the sender, they have a clear message. The sender should ensure that the message is clear, concise, throughout. So the receiver, the one that's active listening, should actively listen, pay attention to both verbal and non-verbal cues, because they'll be avoid any misunderstanding. So effective communication is the process and the exchange of information in a way that is clear and concise. It's easy to understand, and there are 7 slow everything down. Good. So now let's move on to Unit 3, which starts to look at some of these mental health conditions. And we've already been talking about this, so straight in at the top, we're going to look at what is suicidal behaviour and ideation, what are the signs and symptoms, and what is going to be your emergency action plan. So, suicidal behaviour or ideation refers to thoughts or actions related to taking one's own life. This can include thoughts about wanting to die, feelings of hopelessness or worthlessness, or thinking about that life is not worth living. It can also include things such as making a plan or gathering materials to do so to attempt suicide. So that's our textbook definition. And what we tend to say is we need to look for the signs and symptoms for this. And when people complete suicide, people go, we just didn't see it. But people do give away subtle signs. And these subtle signs might be this. They may be talking about suicide. Well, that's not that subtle at that point, is it? But they may be talking about suicide or express a desire to die. You may see this withdrawal from social interaction. So have they gone quiet? Are they, just disappearing from the world as such? Is there a sudden change in their mood? So have they become very sad, or have they become cured? So were they sad and now they're really happy? So you've got that sudden improvement as well, which is odd. And that might be because they've now see a way out. Are they starting to give away things? Are they making financial arrangements? Do they already engage in risky behaviour? So what does their risk look like? Are they involved in drugs and alcohol? And are they expressing feelings of shame or guilt? Now, I do have, if you go to my YouTube channel, I do have a full-on session about managing suicide. And we talk about the nice guidelines. We talk about managing risk. We talk about the turning points. We look at putting people into safe spaces. But for this session, we just need you to try and recognise it and put together an emergency plan. So if you or someone you know is experiencing suicidal thoughts or behaviours, it's important to seek medical help. Ideally, the concerns should always be taken seriously because we never know. And resources should be available to help. And those resources can include crisis lines, groups, or mental health professionals. So here, then, is an acronym for dealing with your suicidal behaviour. So I want you to stay calm and focused. I want you to understand the So let's look at the connection piece that we were talking about here. So we've got Samaritans, that's great. They're 24 hours a day, 7 days a week. We've got the Hope Line UK, Parisis there, and you've got the number. And be mindful, this is for underage 35-year-olds. We've got Calm Zone, that's from 5 p.m. till midnight. So that's a great resource because if you're at night time and you're managing this in the evening, that's a great resource. There's Mind there, Monday to Friday, and then there's the NHS, which has an absolute comprehensive list of resources and apps and things like that. You just need to be able to do that refer on. So find something that's useful so they can connect and the professional can take over. So hopefully that gives you a little overview on managing suicidal ideation and behaviour. So looking for those signs and symptoms, offering that listening skill, that ELGI piece, that suicide acronym, and then those external support tools. So let's move on. Panic attacks. Let's talk about what a panic attack is, some of those signs and symptoms, and let's look at that emergency plan. So, what is a panic attack? Well, a panic attack is a sudden or intense episode of fear or anxiety. It can occur without warning. You get this feeling of being overwhelmed, and obviously it can happen to anyone at any time. So the signs and symptoms here are pretty obvious, really. When someone's having a panic attack, they tend to think that they're dying, so it can feel really scary. But ultimately, you've got this rapid heartbeat, palpitations, shortness of breath, sweating and chills, shaking, feeling dizzy, nausea, tingling of the hands and feet, some chest pains or discomfort. There's that massive fear of loss, that they're going crazy, and that fear of dying, because ultimately it can appear to be really distressing. So what is the emergency action plan for a panic attack? Well, we want them to provide a calm and reassurance presence. So be grounding, be that mirror. So these are your external resources. Anxiety UK is amazing. I've done a lot of work with referring to people to there. They've got so many great resources online there. Mind is really good. Lots of psychoeducation from Mind, and psychoeducation is about providing advice and guidance, really. We've got 111. It might be the fact that they need to talk to their doctor. They may need a medication review or something, or a PRN, just to keep them well, so some medication. There's the Samaritans there, and there's this wonderful charity called No More Panic, or No Panic. And again, you can see they're open from 10 till 10. And that charity provides advice and guidance. There's lots of videos and lots of resources on how to manage panic. So, lots of onward referral, lots of things that you can do. And again, if you go back to my resources, that's in this course. So if you click on the interventions, you can go through some of those interventions with them, or even give them the guided meditation video that I've done. So number 5, what is psychosis? So we're going to look at what psychosis is. We're going to look at some of those signs and symptoms. We'll look at what it is in an emergency and the action plan. So psychosis is a mental health condition, and it's characterized by a disconnection from reality. And that's where the individual experiences maybe some delusion, but it's not real. So it may be hallucinations, it could be distorted thinking or speech. So they come across slightly paranoid as well. So what are the signs and symptoms here? So you can see just above, we've got delusion. So it's around their belief system. So they have a very strong belief. Hallucinations, so that could be sensory, hearing, seeing things, lights, distorted thinking. So if we're thinking quickly, that may be rapid speech or disjointed or illogical speech. There's the paranoia, so that's the lack of trust, overthinking. There could be a change of mood, and psychosis can occur when a result of mental health conditions such as schizophrenia or bipolar or severe depression. And actually, it's a symptom that those mental health conditions are becoming much worse. If you recognise or see psychosis in somebody, you think, oh, sounds like psychosis. I remember seeing that in Steve's training. It is absolutely important we get that referral into their emergency services quickly, because it may mean that they'll need a medication review to keep them safe, or secondary care. So the hospitals and GPs may already have a crisis or treatment plan ready for them. So how to treat psychosis? What is the emergency plan? No surprise in here. The has come along. So here, our external services then, we've got Rethink. They've got lots of stuff on psychosis, schizophrenia, and those extended mood disorders for over 2 years. But again, we've done lots of videos on those in the Mental Health Nurse website. So you'll see those at the end here. Mind is a great charity. There is early intervention psychosis teams with the NHS. There is the 111. And there is the National Association for People with Psychosis, so NAPA. So there's lots of different things there. Again, that onwards referral piece about supporting somebody. So let's look at depression. Here we're going to look at 2 types of depression. We'll start on the mild up to the severe. So we're going to look at what depression is. We'll look at those signs and symptoms, and we will look at those emergency action plans. So, depression is a mental health condition that affects a person's mood, thoughts, and behaviour. It is normally characterised by feelings of sadness and hopelessness, and depression can be caused by a variety of factors. And let's face it, life is tough at the moment. So, it could be health, it could be social, it could be family, it could be genetics. There are many factors why people might be feeling sad. So symptoms of depression. So on the lower side, they would need to have these for at least 2 weeks to be diagnosed with depression. But for it to go to severe or chronic, it's normally for more than 2 years. So 2 weeks to 2 years. And here we're looking at that feeling of sadness and emptiness. So if you ask somebody how they feel, they tend to go, I'm just blank. And I've done a really good video on the Mental Health Nurse page on depression in much more detail. Loss of interest, loss of weight, perhaps becoming a bit more dishevelled. Loss of sleep, routine, feeling quite flat, no energy. Difficulties concentrating, remembering. Feelings of worthlessness and guilt. And again, it is not uncommon for suicidal thoughts. And when I say it's not uncommon, I would say 90% of the people that I met in primary healthcare, and you are talking probably about a good couple of thousand people that I've seen there, it was not uncommon. Between 80 and 90%, I would say, had suicidal thinking. But they're just thoughts. They came, they went. That's fine. So it's normal. So we should normalise that as well. It's not uncommon. The problem is it scares people. So we need to do a bit of education around that. So here you can see the depression acronym. So here we want to discuss their safety, assess the risk for harm. Are you feeling suicidal? Do you have any plans of self-harm? Do you want to harm yourself or others? We want to empathise and listen non-judgmentally. Must be hard for you. I can see you look upset. I can see the distress, which is better than you saying, that must be hard for you, or, oh, I know how you feel. We want to avoid that. Just say what you see. I can see this is upsetting you. Provide that reassurance and support. You know, it is okay. We can get over this. There is a lot of support there, and we can promote that recovery piece. Recommend professionals, so that connection, and that might be, look, I generally think it's probably now's the time you go to your doctor. Now's the time you need to go and seek that additional support. You may want to encourage that self-care, positive coping strategies. So again, if you look at my interventions and resource videos, I've got lots on there for you to go through, to pick and to help. Positive self-thinking, reframing thoughts, visualization, acceptance and commitment. Lots of things there that you could do. Here, screen for any other mental health concerns. So if you're thinking, is it just depression or is there anything else potentially there? Identify the potential triggers. So sometimes we end up over medicalising stuff. It may just be, I'm losing my house. Okay, well that's then probably quite normal to feel sad and down. So what we need to do is get you some help on housing. Have you phoned the housing officers? Have you talked to charities? Have you done, turn to us? Maybe look at social prescribing. It might be, oh, I've got a problem with my kids. Okay, have we talked to social services? Have we talked to the schools? So let's not over medicalise some things, but let's recognise some of these triggers. And again, one of the coping skills is providing somebody with planning skills and coping skills. So again, we've done videos on those that you can refer to, because sometimes people just can't see the way forward. So them having that discussion with you, offloading those feelings, can clear their thoughts and allow them to manage the way a way forward. Again, offer the practical assistance, so that could just be help to achieve those tasks. And again, normalise those experiences and offer that hope and reassurance. So lots of services here to help. We've got Mind, Samaritans, NHS, Calm, which is the campaign against living miserably. There's a wonderful website called the Hub of Hope, which I haven't put on here. And the Hub of Hope is the first national database for mental health. So you just go to www.hubofhope.co.uk. I'm sure it's .co.uk. If it's not, do .com. I'm sure it's .co.uk. You pop in your postcode and it will tell you all of those services around you. And then finally, we've got the Depression Alliance. So there is a lot of support for people to go to, because I know if you pick up the phone and you're saying, look, talk to your doctor, they're going to go, but I can't get an appointment for 2 to 3 weeks. We've got some resources here. Let's get that ball rolling whilst you're waiting to talk to your doctor. Let's provide you with some recovery options there. So, looking at Unit 7, we're now going to go to substance abuse. And here we just want to discuss what substance abuse is, what are the signs and symptoms, and what are our action plans. So substance abuse, or I like to call it substance misuse, is also known as drug abuse, and it can happen with excessive or harmful use of drugs or substances. So I think substances can be characterised as money, sex, drugs, alcohol, phones, technology, gaming, and anything else that increases your high dopamine levels where you get addicted to it. And basically, it has a negative effect on people's physical, social, emotional, and their overall well-being. And it leads to poor choices, health problems, social isolation, financial difficulties, and obviously legal issues because we prioritise something. Now, I did a training course a few years ago, and a really useful way of talking to somebody when you say to them, you know, do you think you've got a problem, is to say to them, look, the way a substance misuse is kind of categorized is it affecting your health? Possibly. Are you prioritizing this above your normal daily activity living or activities of daily living? So are you prioritizing, say, for sleep, your relationships, or work? 3, does it affect the people around you? And 4, is it causing you a financial burden or strain? And if you meet those 4 criteria, you probably have an addiction problem. So let's just have a look at this then. Some of the signs and symptoms of addiction there that includes changes in behaviour, because if people get withdrawn, they can have mood swings, and it can be really difficult to manage. Increased in risky behaviour, so that could be making poor decisions, driving under the influence of alcohol, unprotected sex, all of those risky strategy stuff. Neglecting your responsibilities, so becoming withdrawn, creating financial difficulties, relationship problems, physical symptoms, so that could be you becoming gaunt, grey, bloodshot, your skin may be changing colour to yellowy, so lots of obvious physical signs. There may be withdrawal symptoms, and then finally that craving or strong desire. So substance misuse is a real difficult problem, and again, depending on your background, your history. So do you have other mental health disorders? Have you got neurodivergence? So for example, if you've got ADHD, it can be really difficult because you're more likely to have an addictive personality. So we absolutely need to be non-judgmental here, and we need to be offering those early interventions. So how do we do that? Well, here we've got our acronym, substance, and there we need to stay with the person, ensure that they're safe, use that non-judgmental language, be empathetic, be aware of potential withdrawal symptoms or overdosing. So we never want somebody to stop or go cold turkey. It's dangerous. The body has been reliant on this, or the brain has been reliant on that behaviour. So it should always be a slow reduction with supervision, and that supervision should always be under medical attention and advice. Talk to the person about their issues and look at the potential triggers and stressors. So are they using this to self-medicate? Are they trying to escape something? Maybe they just need to go for some cognitive behaviour therapy. Maybe they need some treatment for trauma. But whatever it is, I bet your bottom dollar they're using this as a coping strategy. So they've got this internal pain and they're just self-medicating. So it's a distraction. So assess the person's level of substances and any underlying conditions. Normalise that experience. It's common for people that are having alcohol withdrawals to have these highs and lows and mood swings and cravings and thirst, and just if we normalise that, then we kind of bring in that recovery model. Connect with that person and encourage them to seek that ongoing support. So let's look at some of the referral on points. We've got Frank for substances, Drinkline for alcohol, narcotics for drugs. So again, depending on what it is, would depend on the line of referral. Now, what I would always say to you is, in primary healthcare, when I said to people, look, do you think we should do a referral? They'd go, yeah, I'll do it. They never did it. So encourage them, allow them to get to this point, but offer that support and say, look, would you like me to help you do this? We could do this together. I could make that call, and because they may just be afraid. So offering that assistance. But if they go, no, don't force me, fine, don't force them. Obviously, people need to do this in their own time, but at least you've got a list of external services there that you can refer them on to. So, moving on to aggressive or violent behaviour then, we'll look at what that is, we'll look at some of the signs and symptoms, and we'll look at the treatment plans. So here, aggressive or violent behaviour refers to the actions around harm or physical or emotionally. This type of behaviour can cause a variety of factors, including underlying mental health conditions, substance misuse, stress, trauma, environmental factors such as poverty or community violence. So normally violence breeds violence. And if you're experiencing this, or you know somebody that's got anger, I have done a video so the mental health nurse, click on there, go to my video on anger, and we tell you how to manage it. But ultimately it can be a real problem. So what are the signs and symptoms? So obviously we've got the normal ones here: the physical violence, hitting, kicking, biting, verbal aggression, shouting, intimidation, damaging property. It could be hostility, it could be outbursts of anger, uncontrollable impulses, substance misuse, or perhaps there is a previous history there. So lots of signs. Equally, people with neurodivergence, so autism, ADHD, they find it very difficult to self-regulate and manage that emotional regulation piece. Not all of them, but it can be difficult at times. So here we've got our acronym called behaviour. We're going to be calm and be non-confrontational because we don't want to inflame the anger. We don't want to gaslight anything. We want to ensure our own safety. We want to help the person to de-escalate, so using calming techniques. So go back to those interventions that I've shown you. That could be breathing, that could be distraction, that could be music, that could be any of those techniques lower down. We want to acknowledge and validate their feelings and frustrations. So I can see you're angry, I can see you're upset. I just need you to tell me, how can I best help you here? What is it I can do? So we want to validate that person, respect them, and allow that control. We need to identify the triggers and stressors and see if we can manage that. And we need to offer better options and choices to help the person feel more in control. And we want to refer them onwards. So here's some services there. So we've got the Respect phone lines, and that's a support service for men. There is Women's Aid, which is a service for women. We've got Mind, which does the whole population. 111, again, which does the whole population. And there is the National Centre for Domestic Violence. And again, that is for men and women. Because nobody should have to live in fear. And ultimately, there is help out there for people with anger. There are support groups. There are self-regulatory things that they can do. There are self-help aids. There is medication. There are tools out there to help people manage it. Please do not accept the fact that when somebody says to you, I can't help this, that is the answer and that's where it stops. There is support out there to manage challenging behaviour there. So, number 9, looking at acute stress. So, understand what stress is, those signs and symptoms, and the action plan. So here, the acute stress reactions, often symptoms occur through trauma, disasters, acts of violence, and these symptoms can last or happen within minutes, but last for hours, weeks, or days. So signs and symptoms there is anxiety and fear, shock, confusion, numbness, mood swings, disturbances, insomnia, nightmares. So again, we've done a video on that. Watch the sleep hygiene video, watch the video on insomnia. That will help you bring together a better treatment plan. Physical symptoms such as headaches, muscular tension, nausea, avoidance, try and avoid any of those traumas or avoidance of an area. So sorry, what we mean by that is, let's say somebody had a car accident, they'd already get back in a car, so there's that high avoidance of the trauma. And then hypervigilance, so they're on this constant alert response. So how do we manage people with acute stress? So we want to stay with the person, we want to talk to the person to calm them down, we want to reassure the person about their feelings are normal, encourage those self-care techniques and relaxation, so that's deep breathing, muscular, EFT, so emotional freedom techniques, or indeed EMDR would work really well here as well. And again, we've done videos of those in the YouTube channel. Seek professional help and support the person to seek additional resources. And there you've got your list of external services, so Mind, 111, Anxiety UK, Samaritans and Trauma Aid. So moving into a bit more difficult as a subject, self-harm or self-injury, we'll discuss the signs and symptoms and the action plan. So here we look at self-harm refers to the deliberate or intentional injury to oneself. This can be cutting, burning, scratching one's skin. Self-harm can be a way of individuals to cope with emotional pain, anxiety and stress. So we need to understand that this is a coping skill. We don't tend to like to say it's a wise coping skill, but we're in, people are allowed to make unwise choices. So we can't stop it. We don't want to stop it straight away because that could be dangerous. But what we will do is offer first aid, make sure signs of infection, sepsis, all of that stuff that we would do. So looking at those common signs and symptoms, that could be unexplained scars, wounds, scratches to the skin, wearing inappropriate clothes for weather, so maybe you're wearing long sleeves when it's hot. You may have blood on clothing or bed stains. You might be spending a lot of time alone, avoiding social situations. You could be expressing those feelings of worthlessness and hopelessness, so again, linking very much to depression. Keeping sharp objects to hand, so it doesn't necessarily need to be knives and blades. People have used many different things over the years that I've seen, from wire to CDs being snapped. It's not difficult to find a sharp object. Signs of depression, again, appetite and sleep, and difficulty expressing mood. So how do we manage somebody who self-harm? So we need to stay with the person, ensure that they're safe. So, again, treat any injury that needs to be treated using your basic first aid skills. Express empathy and understanding. Don't ever say to somebody, I don't understand why you do this, or you don't need to do this. Just listen to them and just say to them, look, do you want to talk to me about this? Is there anything that I can do to help? And just listen. That must be difficult for you. I can see that looks sore. Do you want me to get you anything? Find out the extent of the person's self-harm behaviour. So is there a trigger? Is there a trigger day? Maybe they just don't like a particular day. Maybe there's an exam coming up. Help the person to develop better coping strategies. So again, in the Mental Health Nurses website, my YouTube channel, I have got coping strategies. There's a video there on how to do that. Assess the person's risk for suicide. So we've already spoken about that, so you've got an idea there. And refer the person to appropriate resources such as mental health professionals or crisis. And then obviously manage those wounds. So external sources here then, we've got Mind, Samaritans, Self-Injury UK and the National Self-Harm Network. And if you're below the age of 25, I think it is, there's the Mix, and they are an amazing service. I have recommended them to many of the people that I've worked with in the past, and they offer a crisis line text service and they offer one-to-one support as well. So they are an amazing charity. So moving into our last section now, so we're going to talk about what CAMHS is, some of the signs and symptoms and the action plan. So CAMHS really looks at the Children's Adolescents Mental Health Services, and it is for anyone under the age of 18 experiencing mental health. Now, signs and symptoms are no different in children as they are in adults, really. So if we suspect that somebody is unwell, we shouldn't just ignore it and go, oh, that's normal childhood. You know, they just need to learn to manage this. If we see signs and symptoms, we should be concerned about them and we should be managing those, because CAMHS has a huge waiting list and it is very difficult to get children the right help that they need. I would say nationally there are lots of organisations set up for children. So for example, where I'm from, down in East Sussex, we've got lots of organisations set up by the local borough councils for children, and there are other charity support groups that do art therapy, music stuff. So it's about finding the right stuff. So services there for young children. Then we've got Young Minds, which is great. The NHS website offers support for CAMHS. Again, the Paralysis site for self-harm, suicidal thinking for children. Child's Line for under the age of 19. Young Minds for parents. And that's a helpline for parents and carers, because ultimately, as a parent or a carer, it is exhausting worrying about how to look after your child and keep your child safe. So please do not just go, I need to go to my doctor on this. You need to throw everything at this to get the right help. And then obviously the mix. So your emergency plan here then is communicate and encourage open communication with the child. Actively listen to their thoughts and feelings. Validate them. Don't just go, oh, you're 10, you shouldn't be feeling like that. Or when I was your age. Just listen to them. They want to be heard. Advocate for the young person. Make sure you get them to the right support lines, charities, organisations. Respect the person, treat them with dignity and acknowledge their strengths. You know, you've done really well to come to me. This must be really difficult. Empathise and show that understanding and validate that they've been heard, and support them with developing those coping skills. So again, the videos that I've done in the online course or via YouTube, there are lots of videos there about coping skills and distraction skills. And remember that every young person is different. Nobody has a one-size-fits-all solution. And working with young people can be really challenging in getting the right support for them. So it is all about early intervention. I've already been saying about my YouTube channel. So here we've got the Mental Health Nurse Providing Hope. There is the link to my YouTube channel. And in there you can see there was 50 videos at the moment. I'm hoping more, well, I'm not hoping, there is more to come, because this is one of them. And in there, lots of different techniques. So it may be the fact that you're uncomfortable with following some of the things that I've suggested in the videos, but what you could do is play the video with that person. So you could say, look, let's do a breathing video together. Let's do the visualization video together. Let's do EFT together. And by you doing that, you go back to that ELGI acronym. So let's summarise what we've covered today. We've covered the role of the mental health first aider. So that's the 4 Ps: preserve, prevent, promote, and encourage that recovery. We talked about effective communication skills. We looked at SOLA, so sit, open, lean, actively listening and take part. We talked about the sender and receiver, and we talked about being non-judgmental. We then moved into suicidal behaviour, so we understand that we need to be open, we need to ask those questions, we can't assume anything, and we need to make sure that we can offer that safe space to keep somebody safe if we're worried, and offer that referral piece with all those numbers, or download the Stay Alive app. We talked about panic attacks. We recognise those signs and symptoms of panic, keeping them nice and calm, normalising that behaviour and help re-regulating them. We talked about psychosis, so that's the altered perception, delusion, different sense of reality. We talked about that early intervention, getting them back into secondary care as quickly as possible to their GP, because they may need a medication review, and that's a sign that their other mental health conditions may be deteriorating. So again, keeping them safe, doing that onward referral piece, grounding skills, relaxation. We looked at managing severe anxiety and depression, so looking at low moods, not eating, not sleeping. We talked about the YouTube channel, doing sleep and other activities to help manage that. We talked about that you need it for at least 2 weeks to be diagnosed with depression and up to 2 years for the acute and the severe bit. We talked about substance abuse, and we talked about recognising signs and symptoms of substance. We talked about the criteria. So is it affecting your health and well-being? Are you swapping? Is it causing you financial problems? Is it affecting your relationships? If it is, we probably need to do something about it. We talked about those other agencies to refer on, and we talked about the importance of not stopping until you're under medical supervision. We talked about violence and aggressive behaviour. We talked about the responses. We looked at anger, physical fighting, fear, intimidation. We talked about the emotional regulation part. We talked about coping skills and different strategies. And we talked about that onward referral for getting help to manage that. We looked at that acute stress, so response to trauma. We talked about different therapies there, such as EMDR, emotional freedom technique. We then looked at self-harm and managing that from a first aid point, and that onward referral and the self-injury. And then finally, we looked at CAMS, which was the Children and Adolescent Mental Health Services, just talking about that onward referral and getting the right help. So the question is now, you've watched the video, would you like a certificate for your new skills? If you would, all you've got to do is follow this link. It'll take you to the Canvas site. You need to go into the Canvas site, just enroll, and there's a multiple choice exam. At the bottom, there is a form that you need to fill in, and that form will then release your certificate. So as long as you pass the exam, so you need 80% to pass, and as long as you have watched the videos in full, and we will know because the videos are timed. And what it means is, if you do want the certificate and you've watched this, that's fine. But ultimately you need to be doing it in Canvas, so you unfortunately might have to just play this video back in the background, just review it ready for that multiple choice test. And at the end of the day, it is only an hour's worth. And I appreciate that this is a huge amount to take in a short space of time. But actually, we've covered all of the main things. We've covered what they are, we've covered the signs and symptoms, and we have covered the ways of managing it. So hopefully you feel a bit more confident in managing an emergency situation where if you had somebody presenting with mental health, you could give them some sound advice in supporting them. And equally, if you go back to the mental health YouTube channel, you have all of those resources in there as well. I wish you all the best of luck. I hope you found this course useful, and I welcome any feedback. Take care. Bye for now. And don't forget to subscribe to my YouTube channel. And finally, some copyright. Please don't copy everything. I put a lot of work into this. You are allowed to use it. I just don't want you to alter anything. And if you do want to use stuff, please just